Thank you very much, Prof, for joining us. Now, we used to record in the past few weeks since moving to level 1 about 1,300, 1,100 new COVID-19 cases per 24 hours. Now we seem to be going back to the 2,000. Are we perhaps seeing another, another rise in the infection rate now?
I think we should be cautious about that, but you're quite right. There are fluctuations, and you've seen those fluctuations over the last few weeks as we've moved into level 1. And they've normally been under about 2,000 or thereabouts. So this is probably the largest absolute increase in the number of cases. But I think we should just bear in mind that when we look at the positivity rate, that has not changed in any dramatic way. It's still about 8% or thereabouts. And I also looked at the hospitalization rates. Admittedly, there will be a lag in that. And again, the hospitalization rates are still coming down overall. So I think you're right. We need to be cautious about how to interpret that particular data and see what the trend is. If there is an upward trend, then yes, we may well be seeing a surge. But at this particular point, I'm not sure that we can actually call that this is the beginning of a surge. There's ongoing transmission, obviously, and there's ongoing deaths. You've highlighted that in your report, and that is of concern, that people are still dying. And that means we still need to then ensure that we are not complacent around what we're expected to do to prevent transmission.
Now, Professor, we've moved to level 1 of the lockdown, and of course, South Africans, we are excited about that part, being able to travel to other countries, especially as the festive season looms. But could we see, if this continues to rise like it has in the last 24 hours, could we see ourselves being moved to a higher level than alert level 1?
I think there will be subtleties around that. I think we need to understand where these infections are occurring, if there are clusters or outbreaks. Can we manage these? I think there'll be a concern around moving back to higher levels of lockdown. But perhaps within specific settings, we would actually try and see how we could manage and control those particular events. So the testing, therefore, becomes really critical for us to understand, and as well as the tracing, tracking, isolation, and quarantine. All these particular aspects are really critical around controlling that in order to ensure that we don't face what we've seen now in Europe or the United States, where people are talking about going back in terms of a more severe lockdown.
I think it's also very important, Professor, for the NICD and yourself to perhaps just tell our viewers and other South Africans out there how important it is to, continue to realize that this pandemic is still with us. It's actually not gone. Just because we're on level 1 and we can, go out to each other's houses more than we used to earlier in the year, it's important to remember that this pandemic is still with us.
Absolutely. I can't emphasize enough that, in fact, transmissions are ongoing. We're still seeing, as I said, about 2,000 cases or under every day becoming infected. We're seeing people dying of this particular infection. We're in the summer months. We're in closer contact with each other. We would like to be in closer contact with each other as well. But I think we need to ensure that our bubbles are safe. And in fact, the physical contact must be limited to 2 meters or more. We should ensure that we're wearing the face mask. In fact, there's greater evidence that, in fact, that the face mask or cloth is really, really critical in terms of prevention, as well as the fact that within our workspaces, at malls, at restaurants, all these particular factors around ventilation and contact should be limited and monitored to ensure that transmission is occurring. And again, we have vulnerable people in our community with specific age groups, with specific comorbidities such as diabetes, hypertension, cardiac and respiratory diseases. These are all the necessary mixing bowl, if you like, for continued transmission. So even though we would like to see Christmas come along, it's important that we still adhere to all these particular aspects to ensure that we prevent transmission.
I think you touched on this a little bit earlier, Prof, the fact that in our hospitals there's still less people admitted to, for instance, the ICU wards compared to earlier on during winter when we saw our peak. So does this mean even with the infection rate, we're concerned about the infection rate going back to the 2000s, even if it's one night, but does this show that people are healing more at home, doing their own self-isolation?
I'm not sure. Again, I think we had concerns about people not going to hospital. And again, I would like to encourage people who are unwell, whatever the condition is, to actually go to hospital or ensure that they can have access to medical care. But it simply means that people are still vulnerable. Because if you look at that death rate, it's over 17,000. And if you think about 100 people dying every day, that's going to accumulate far more than we've seen, for example, during the flu season. And remember, we never really spoke about mortality during the flu season, but it certainly has certainly become important as those numbers continue to climb. So yes, you're right. I think the majority of people are recovering, and we can see that, but there are still many vulnerable people in our hospitals.
Well, thank you very much. That is Professor Adrain Puren from the National Institute of Communicable Diseases.